Here we have infectious diseases manifesting on the skin and eyes. Chapter 19. So here's a diagram showing the layers of the epidermis, and then for your skin, so the epidermis is the top, is what the whole section's called, and then you can see where they've got it broke down. The epidermis is the outermost portion of the skin, and the stratum part is uh, epithelial cells. The cells in this layer is also the keratin. So here's some more on the skin. So we got the dermis, which is into two layers, the papillary layer and then the reticular layer. So the dermis is the source of the epidermis cells. It produces your hair, follicles, and glands. It's also connective tissue, nerves, blood vessels, and your lymphatic. Here's just a diagram so you can see, and it shows everything bigger. Up here at the top you got your hair shaft and your sweat pores, capillary, and then you can see the little top section right there on the left is your epidermis, which consists of the stratum and the basal layer. Then your dermis is down next, and the subcutaneous layer is last. Here we have the normal biota of the skin. On the right, you've got two sections that fall under it, and then over here in the diagram you can see, like, it's got up here the oily, the dry, the moist, and then you got the foot down here. The normal biota survive in dry and safety conditions. Not safe, salty conditions. I can't talk. Sorry. These are the two most normal biotas that are on our skin. So here we have MRSA, which is MRSA in the skin and the soft tissue infections. So MRSA, as you can see on the first bullet line, what it is spelled out. So the MRSA is its abbreviations. But anyway, MRSA is it's common cause of skin lesions, as you can see in the picture on the right. That is MRSA. And then it can get in your bloodstream if you don't catch it in time, and that can be very fatal. So you definitely would need to go to the hospital if you had something that looked like that. Here we have impetigo. It is a superficial bacteria infection that causes the skin to peel or flake. As you can see in the diagram, here's a picture of what impetigo could look like. Impetigo is highly contagious. It's not a serious disease, and it is seen more in children than it is in adults. Here we have cellulitis. Cellulitis is a fast-spreading infection in the dermis. Over here, I've got a little diagram. So you can see on the left leg, it's early or mild cellulitis. See up here, it's just red and it's swollen, it's got heat to it. Now if you look at the leg on the right, the leg on the left, sorry, is the one with the earlier mild cellulitis. And if you look over here on the right, the late or severe cellulitis. Now this is what it looks like if it goes untreated or gets worse. It spreads the whole area gets bigger and the pain gets worse too. And then, of course, the redness travels. With the cellulitis, it's a fast spreading infection in the dermis. So it doesn't take long for it to spread, and you can see, like in the pictures, it's 3 times the size. You can get septicemia from this, which would make you septic. That's when the infection gets in your blood. That can be very dangerous. And cellulitis is also, it's very common for it to be seen in the legs. So here we have the staphylococcal scalded skin syndrome, which the abbreviations for that is known as, you see here the 4 S's. So on the left is a picture of how bad, skin looks if you have this. It's mostly seen in newborns, but adults and children can get it. It's just not seen in the adults and children very often. It's just usually the newborns. Here we have gas gangrene. So I've got a diagram over here on the left where it shows where the legs had set up with the gangrene, so they had to cut it open to get the infection out. Gas gangrene is a very fast progressing disease. If treatment isn't started earlier right away, this disease can be very fatal. It can also cause you to lose your limb. Here we have chickenpox. So on the right, I've, I've got a picture and it just shows what the little chickenpox bunks looks like. So with chickenpox, they're thought to be a mild disease for most people that get them. Um, older adolescents and adults, for older adolescents and adults, if they get it, it could be life-threatening. They did come out with the vaccine in 1995. So you don't see chickenpox as common as you did back in the 80s and early 90s before 1995 and the years before that. So here's just a diagram to show, because we're going to go over shingles. So this is the chickenpox 2 shingles. So you can't get the shingles, or you can't get, yeah, that's right, can't get the shingles without having chickenpox first. So the shingles happen after you've had chickenpox. The shingles develop after the virus is reactivated. So you'll see shingles more in the people that had gotten chickenpox from before 1995, because that's when there wasn't a vaccine for it. But you can see the difference in what the two are. The shingles herpes zoster is a skin rash caused by a virus called the Varicella zoster, the same virus that causes the chickenpox. Um, so it shows you over here, like for you, if you look at it in the skin's surface and the scab, and then if you look at the two little human diagrams over here on the right, you can see that it shows that the shingles usually attack on just one side of the body instead of being all over the body like the chickenpox do. So here we got the hand, foot, and mouth disease. So if you can write it out as HFMD, and that stands for the hand, foot, and mouth disease. So with that, it's most commonly seen in babies and children under the ages of 5. It is contagious, but it's mostly during like the first week of the illness. And then I've got a little diagram over here on the right. It just shows, you can look at it and it tells you what it is, what causes it, and how does it spread. So it is contagious and it can spread by touch. So here we have rubella. So rubella is also known as the German measles. Um, it can do serious damage can occur with the rubella. It's broke down to it has like different categories. So there's postnatal rubella, congenital rubella. So with that one, the mother can pass it along to the baby. Um, and if you look over here at the diagram on the left, it'll show you what symptoms come with having rubella and then the dangers of it. And you can see up here at the top, rubella is an acute contagious viral infection, and it can spread airborne droplets, sneezing or coughing. So it's very easily spread. So here we have the fifth disease. Now the fifth disease got its name because 120 years ago, it was the fifth disease to be recognized. So fifth disease has been around for quite a while. Um, it's also called erythema infectious. It's an illness caused by a virus known as the B19. So the condition often leaves a blotchy red rash on your face. So you can see down here on the bottom of the diagram, it shows like symptoms and things like that. So here's a diagram. Was going to go over um, the rosella, which is over here on the right. It also had, I liked this diagram because it had the rubella with the German measles and then the other one over here on it too. But for the one on the right, it affects young children 6 to 36 months old. You have high fevers with it. It's sometimes known as the sixth disease, and it's mostly common in babies and young children. Uh, you can also get seizures with this, and rosella is caused by the human herpes. So here we have ringworm, and it is a fungi is what originally causes all this. But over here you got your signs and your symptoms, and you can see on the lady's neck, that's what it shows what the ringworm looks like. So here we have conjunctivitis. You know, it's a pretty common infection in the eye. Here is a little diagram that shows three eyes, so you can see the difference. The healthy eye on the left, then in the middle it's watery with discharge. So this is usually when it first starts. And then the one on the right is full-blown conjunctivitis. So you have to go get eye drops, antibiotic eye drops to clear this up. Here we have river blindness. Uh, river River blindness is a chronic parasitic infection in the eye. You see this um, here. You got the parasitic disease, which is a fly carrying the disease, and then you got the infection, the reproduction, and the transport and all that. So here we have trachoma. Um, Trachoma is a chronic eye infection. It's major, causes blindness. You used to see this a lot in Africa and places like that. Um, but you can see on the top diagram, the eyes got a little bit of little nodule bumps in it. And then the second one's got a lot of scarring. And then when you get down to the third one, that's filmed over really bad. You definitely have to get go to the doctor and get antibiotic eye drops in order to get rid of that. So trachoma is almost always affects both eyes as well.